This episode of the Beauty by ABIC podcast is brought to you by Device Consulting.
Hello and welcome to the Beauty by ABIC podcast, your online support community for the aesthetic and beauty industry. Here we are strengthening and unifying the industry through representation, innovation and education. This is a platform created and dedicated to the aesthetic and beauty industry, valuing unity and advancement. We serve to represent, support and inspire you by connecting you with industry experts, expanding your knowledge through educational pieces and bringing you the latest industry news. This is Beauty by ABIC.
Today's guest is Jean Wilson from Device Consulting. Jean started her professional career as a registered nurse in intensive care more than 15 years ago, and she discovered her passion for skin shortly after. Raised in North Queensland, Mackay, Jean moved to Brisbane to complete her schooling and university studies in Brisbane at Queensland University of Technology. Jean studied a dual Bachelor of Nursing and Applied Science and completed a postgraduate certificate in 2010. Having been in the industry for quite some time, Jean has extensive knowledge and experience with various energy and heat-based devices in medical aesthetics. Jean is a Queensland Radiation Health Laser Safety Officer and Operator and is providing clinical support to Omnilux and Tixel users all throughout Australia and New Zealand. Here to discuss combination therapies and treatments from Device Consulting, today we welcome Jean Wilson. Hello and welcome to Beauty by ABIC podcast. Nicole Montgomery here. Today I am joined with Jean from Device Consulting.
Hi, Nicole. Hi, everyone.
Hi, Jean. Thank you for coming on the podcast today.
It's my pleasure. Thank you for having me.
You are most welcome. We're very excited about the conference on the weekend and very excited that Device Consulting are platinum sponsors. But I'd love to start with learning a little bit about yourself and how you entered the aesthetic industry.
Well, as a nurse, I stumbled across the aesthetic industry many, many moons ago, looking into skin, which has always been my passion, and helping people. I realised that I could do both. So improving people's health was always something that I was very passionate about from a young child, and also helping them feel good. But what I realised is skin also helps you look good. And that's how I came to become an aesthetic nurse and laser operator.
That's amazing, Jean. And Jean, this weekend we're going to learn about the Tixel at the ABIC inaugural education conference, which is very exciting. I'd love to learn, what is the Tixel?
Tixel's a heat-based medical device that was designed for skin rejuvenation. Unlike lasers, it's radiation-free and plume or smoke-free. It has a similar result. So you still get tone and texture improvement, but there's just no bleeding. You still get tightening and contraction, and it's renowned for improving that periorbital skin that's quite crepey, as when we live here in Australia under the North Queensland sun, we would all know about that.
Oh, absolutely. I feel like the skin under my eyes is like tissue paper.
Yes, I've heard this many times before.
Jean, so tell us, you've given us a small overview, but what conditions or concerns can the Tixel treat?
It can actually treat a myriad of concerns, so not just crepey fine lines and wrinkles, but also just generalised sun damage, discoloration. It can also be used, and it's TGA approved, for treating benign textural irregularities such as actinic keratoses, which are those waxy sun-related age growths that we tend to see more often on light-skinned individuals. It's also quite popular for the face, the neck and the décolletage, and it can actually help conditions like acne, rosacea, and even melasma.
Oh, wow, that's incredible. So can you tell us the science behind how the Tixel works?
Yes, so lasers, I usually kind of have a chromophore dependent. So they have like a target that they're looking for, or light is similar. Tixel is just pure heat. So it dehydrates the stratum corneum with tiny flat-tipped pyramids pyramids, which can enhance the absorption of topical applications, including Botox for rosacea, or even the Botox will help with large open pores. Internationally, Tixel is being used to penetrate a variety of ingredients directly into the dermis to help enhance their clinical effect. Some of the applications are ALA for acne or photodynamic therapy. Can actually even just enhance the absorption of things like topical anesthetics by using it first. Obviously, any of those photodynamic therapies or photochemotherapies are prescribed by specialist dermatologists or physicians, but you'll see kind of more generally out there ingredients like tranexamic acid used to penetrate deep to the dermis to help with melasma, or you can just use ingredients like salicylic acid, peptides, vitamins A, C, or hyaluronic acid to increase their absorption as well and really amplify their effects and results. So, yeah, it's quite simple, but very exciting.
You know, it sounds remarkable. Who can use a Tixel? Where can I go to have a Tixel treatment?
Tixel's only available in medical aesthetic clinics, doctors and nurses generally. However, it can be delegated to a dermal clinician or laser tech.
Excellent. That makes sense. And can you delegate to somebody who's, say, for instance, just stepped into the industry?
As long as they have some type of experience with skin, then yes, under the supervision of a nurse or a doctor. But Mesotix does exist as well, which is for the beauty industry, which is very similar. But Tixel itself is specifically designed for doctors and nurses. And that's because the array of settings has two separate areas. One of them is the time that the pyramids or the heat is touching the skin for, and the other one is the depth of protrusion that these pyramids are pressed into the skin. And with Tixel, the settings do go up to ablative settings, hence why you do need to be a registered doctor or a nurse in Australia to use or delegate the settings of Tixel itself.
Yes. No, I understand. Yes, ablative can be quite invasive with some serious downtime. And the Mesotix, will you be bringing this to the conference on Saturday?
Definitely. Tixel is, I know, on the cards, and also Omnilux, which I think we'll talk about a little later. But yes, it's good for people to know that Mesotix is out there as well.
Fantastic. It's very exciting. You've got an incredible device, and some devices, unfortunately, take a long time to achieve the results that are spoken about at the beginning. So how long is this going to be a 5-year process of Tixel treatment? How long does it take to achieve the results that you've mentioned? And how many treatments do you require?
That's funny that you say that. Yes, I do have patients that have been having Tixel for 5 years, but that's because I can't send them away. They just enjoy the treatments. But what we actually prescribe or is required is for a particular area is 3 treatments, roughly 8 weeks apart. But what tends to happen is patients have that improvement and see that the efficacy of the treatment, and therefore they come back wanting to treat other areas. And obviously when you're treating things like acne, scarring or stretch marks, these areas will be treated more than 3 times. But for general rejuvenation, the application and parameters is 3 treatments, roughly 6 to 8 weeks apart. There's a mild post-treatment epidermal crusting that lifts usually within a few days after the treatment, about 3 to 5, which is very minimal in comparison to other energy-based devices. So that with the ablative settings as well. And that's simply because their energy doesn't have to be as high as what's required with lasers, which experience scatter and create these columns and bleeding and charring. The heat only has to be a fraction of the heat to get that same result, because we're skipping that step of having it look for a specific target, and it does treat everything.
That's incredible. So based on what you're saying, and noting that obviously we live in a very multicultural society, so some clinics have a very narrow choice of devices. So the Tixel, can it treat all skin types?
Yes, it certainly can. So all Fitzpatrick skin types can be safely treated with Tixel. Darker skins are treated with lower settings using a double pass approach to achieve the same results we would with the higher settings on a lower Fitzpatrick. as I mentioned before, we can even treat conditions such as melasma. Now, melasma is not a condition that you can cure, something that you live with, but improving the visible appearance of it is something that we can do with Tixel, which some people may be furrowing their brow and questioning how that's the case, given that it's using heat. And for anyone who knows much about melasma, this is kind of instigated or kind of worsened with heat. But Tixel does actually touch the skin for such a fraction of the second that it creates these tiny little ports which can then penetrate, which is our open channel treatments, penetrate drugs into the dermis of the skin to help lift that dermal melasma. And that's why we get such great results.
That's amazing. I think you probably will have noticed this yourself over the years in the industry, but I think we learn as we become professionals within the aesthetic industry that there's no magic drug, and we learn every year, what the new latest trends are. What do you see as the future for next year and the up and coming trends in aesthetic?
I would have to say combination treatments. It's what I've seen with cosmetic physicians and dermatologists and nurses as they've progressed with their confidence with different modalities, is that combination treatments, whether it be a combination of the same treatment or combination with applications of topical drugs or medications, or combining different modalities entirely. But this is what I think is the movement that's going to really take off in the next couple of years, or if it hasn't already.
Yeah, absolutely. Yeah, I think it's really exciting. Jean, tell us, in your opinion, what modality would you, or do you believe, would complement the Tixel or the Mesotix?
One of my favourites personally is Omnilux, which is one of the most tested and trusted brand LED phototherapy systems on the market, which I'm sure you've heard of. What it does is it uses a wavelength of narrowband light to create a result within the skin, but it's much different from lasers. So it, as a light therapy, it induces something called photomodulation, and when that target chromophore within the skin absorbs the light photon, it causes this biochemical reaction, and it pairs beautifully with Tixel.
With over a decade of experience, Device Consulting is a leading medical technology provider with a long-standing history, representing and distributing a number of the world's leading devices. Device Consulting work with innovative developers and manufacturers of leading-edge laser, pulsed light, and plasma machines for use in aesthetic and cosmetic procedures. Device Consulting are committed to providing clients a number of the world's best and most revolutionary light systems, together with industry expertise, experience, and professional support, offering tailored solutions covering clinical, technical, marketing, and commercial issues, leading to optimal application of your lasers within your clinic, supporting you from every angle. Device Consulting are committed to ensuring your success. To learn more, visit deviceconsulting.com.au. Device Consulting, helping you in your device investment journey.
This is why we see Tixel taken such a lead recently, is because traditionally CO2 lasers, RF, and all of the different energy-based devices just had so much associated downtime with them. But with Tixel, when we lowered the amount of energy that we're putting into the skin, we noticed that it had less downtime, and then combined with Omnilux, which isn't creating photothermolysis where it's destroying the heat, it's just having that biochemical reaction, we actually get a really beautiful result.
I love a beautiful result. Is the Omnilux TGA'd, and what makes the Omnilux one of the, best LEDs in the world?
Yes, well, Omnilux certainly is. It's got that medical heritage with 40 peer-reviewed studies. It's like a base unit with separate LED heads. So the light-emitting diodes are specifically designed for that and set to that wavelength. So red Plus, and Blue are the three Omnilux heads. So Revive 2 now is the red head, Plus being the near infrared, and Blue, which we know all about as well, hopefully, but the Blues are that 14 nanometer. So the heads mould around the treatment area to ensure that the entire head is positioned specifically 2 to 6 centimetres from the skin surface, because this is what was studied to be the most efficacious treatment. So the published studies that support Omnilux's clinical claims and treatment protocols was designed by more than 24 physicians that were involved in the development of that. And they've come up with protocols for acne, wrinkle, non-melanoma skin cancers, wound healing, and even pain management. Omnilux will have been next year, I believe, the gold standard globally now for medical and aesthetic applications for 20 years.
Oh, wow. There's a lot of really famous people who get very excited about the Omnilux red light.
So this is the one that gives your skin that wow factor and glow. So it's known as the happy light. It's 633 nanometers. And it's absorbed by the cellular mitochondria, which enhances cell vitality. Sounds exciting, doesn't it? And it potently is absorbed by the fibroblasts, which increases collagen and elastin formation. The clinically proven dose in all of these studies that I was talking about for Revive red light is 126 joules per centimetre squared, and that's delivered over 20 minutes with the head sitting between 2 and 6 centimetres from the skin. And that's what's tested, and that is the outcome that you will reproduce for your client when using Omnilux, which is what makes it so well respected. So Revive red light's also anti-inflammatory. It can reduce the time between rosacea reoccurrences, as well as minimise bruising and swelling that's associated with injectable treatments. It's used to eliminate photodynamic therapy. So it's a really exciting light, and probably the most popular one out there.
That is very exciting. And please tell us, for those who are not 100% sure, what is the blue light?
So the blue light is a light, as I said before, it's a wavelength at 415 nanometers. So the standard dose is 48 joules a centimetre square. So it's much less, but again, delivered over 20 minutes. And what it's looking for or targeting is the P. acnes. So it ends up killing that bacteria because P. acnes absorbs blue light. It can be also used to activate 5-ALA to treat superficial actinic keratoses, and it's also used as a combination therapy, the blue light, which is probably the best way to optimize your client's results.
That sounds amazing for larger areas. So, for instance, some teenage males who have quite a lot of acne on their back, or younger women who get quite a lot across their décolletage. Can you use the Omnilux for acne in other areas than the face?
Yes, absolutely. And that's one of the benefits of the specific design of the Omnilux head, which has the 5 panels with the set diodes that can kind of be modulated and positioned perfectly and entirely at that right distance. So, and all of them have that. So the Revive, the Plus and the Blue, they all heads look very similar. It's just what they deliver when plugged in and turned on that's very different.
Oh, incredible. So, trick question, can you have multiple lights?
Yes, you can. One of my favourite for the multiple lights is the Omnilux near infrared, which is the third light, which is 830 nanometres. And that one actually penetrates really deeply to stimulate repair for accelerated wound healing. It's even been proven in post-surgical invasive procedures, which is almost hard to get your head around when you're just thinking that it's a light, but it effectively will relieve muscle pain and actually accelerate the healing in sports injuries, and has been tested with rehab programs. So the near infrared dose is kind of sitting quite low or similar more to that of the blue, which is it's at 66 joules per centimetre squared, again, over 20 minutes. But what it does is it improves perfusion, oxygenation, toxin removal, edema and erythema that's associated with wound healing. I always sneak in and pop that one over my abdomen if I'm feeling quite crampy or bloated. But it can be used also after injectables. And the Plus Light basically is one that makes you feel that you have that tighter, firmer skin. And how it's doing that is it increases the tone in the new collagen that's being formed. So that Omnilux near infrared, which is called Plus. Some people call it a yellow light, but basically it's used in combination a lot. So Plus and Revive will be alternated for wrinkle reduction, skin elasticity, collagen formation, fibrin formation, and skin rejuvenation. You just need to allow 48 hours rest time between the alternation of the treatments. Plus is also used with Revive as well to optimize wound healing, as I said, but then the other two, which is the blue and the red, can be alternated, again with 48 hours between them, for mild and moderate acne.
I'm desperate to go and have a treatment now. I really hope that on the weekend you guys will be doing treatments on the set.
Yes, I'm sure we can if we weren't, but yes, we usually do. So just one of the things that I should probably say as well, in case people are listening in, is one of the things that always stuck with me is that we just don't use blue and red on the same day, which I think is a great thing to mention and has come about with Omnilux's clinical studies and the design of the protocols, and that what they proved is by doing blue and red on the same day that it actually will reduce the efficacy. So that 48 hours between is actually how we optimize our treatments.
That's incredible. Really valuable information. Jean, I cannot thank you enough for sharing over 10 years of knowledge and expertise with us. We are so excited to see you on the weekend at the ABIC Inaugural Education Conference and to learn more from you. You are just an absolute wealth of knowledge. Thank you so much for sharing your time. And I hope we do another podcast, Facebook Live, and lots more in the future.
Yeah, thank you, Nicole. It's been great. You're too kind.
Thank you. Have a wonderful week, and we'll see you on the weekend at the ABIC Education Conference.
I'll see you soon. I'm very excited. Bye.
Bye, Jean.
You've reached the end of another episode of the Beauty by ABIC podcast, your online support community for the aesthetic and beauty industry. Thank you for listening, and until next time, stay connected.